Good afternoon, and thank you everyone for tuning in today to this special media briefing. I'd like to welcome Dr. Elizabeth Richardson, our Medical Officer of Health, Paul Johnson, our city's Emergency Operations Center Director, and two special guests, Rob MacIsaac, President and CEO of Hamilton Health Sciences, and Keanin Loomis, President of and CEO of Hamilton Chamber of Commerce. Glad to have them both here, Rob and Keanin, to obviously share some information with you, our media partners, and community at large, and hear directly what the impacts on our health care system is and in our business sector while we remain in this red category. The move to red category is significant. It is still up to each of us individually and across all sectors to do our part to help slow the spread of this virus. And as you heard during the Premier's briefing just now this afternoon, Toronto, Peel, and York have moved into the lockdown stage of the province's framework while Hamilton remains in the red category. So having Hamilton in the red category is an unfortunate but necessary step in order to protect the health and well-being of everyone in our community. And while we're in the red category, it's important that we behave in a way for the next 3 weeks that will ensure that we don't end up having to implement additional restrictions. So as Dr. Richardson always reminds us, everyone in our community must continue to follow the advice from our public health team. Restrict close contact to your household members only and essential supports. Those that live alone may join with another household for support. All in-person activities should be limited outside of the home to essential activities only. Essential activities like going to work, school, fitness, exercise, access to health care, and the purchase of food or drink or gasoline or automobile maintenance. So please restrict your activities to those items, and the social gatherings are not to be held in your home. Stay within your own household only as much as humanly possible aside from emergencies. And of course, wear a mask or face covering when around others from another household out in public places or in the outdoors when unable to physically distance. And as always, wash your hands. Another critical measure beyond mask that will help eliminate the spread. So if you have any COVID-19 symptoms or are not feeling well, stay isolated at home and get tested for COVID-19. And a reminder that red is just one step away from the lockdown that we're now seeing in Toronto and Peel that we do not want to have happen here, but may if the numbers continue to go up and we start challenging not only our healthcare system, but putting more people in harm's way and potentially more death as a result. So Hamilton, please do your part and follow the current regulations and advice. And speaking of advice, we can always get good advice from our director, Paul Johnson of the Emergency Operations Center. I'm going to turn it over to Paul now to share some thoughts about where we are today and what we need to do going into the future. Paul?
Thank you, Mr. Mayor. And yes, being in the red control category has with it some restrictions, and they are pretty significant. But as people will follow if they're reading the media pieces out of Toronto and Peel region, nowhere near as restrictive as what they're going through. And I would start by saying that it's really important for folks now, as you see these regional approaches and public health unit by public health unit approaches to the level of restriction, that you absolutely clarify if you're reading media reports, whether they're talking about other areas. They could be in a less restrictive zone. They could be in, as Peel and Toronto now are, in a more restrictive zone, that you make sure we're talking about the same communities. So Hamilton information is available on our website, because you'll hear a lot about these lockdown measures, and it may panic people into feeling those are in place in Hamilton, and they're not, although we are severely restricted. When it comes to things like recreation, both our city facilities and privately run recreation facilities, there's now a limit to 10 people in the facility, regardless of its size, at one time. And this includes both coaches and players. So it's not instructors on top of that. It's a total of 10 people. Does not include the staff that work in these facilities from the city of Hamilton or the owners of these facilities, but it does include all the participants who would be coming in. And that's going to apply in our arenas. It's going to be applying in community centers and community halls and a variety of places, no spectators. And of course, The reality is, though, they've also curtailed, as you've heard in the red control area, that there are no games, there are no scrimmages happening. So this is really for training purposes only. When it comes to pools, it's a little different. It's the same as pools have been since we've reopened, which is there are capacity limits placed on pools, and it's generally about 25% of the usual capacity of pools. But that will be determined by the size of the pool and the recreation facility that you attend with the city. As we announced early in the week, we have canceled a wide variety of programming at our recreation centers. People can either have a credit applied or a refund, depending on what they need to have happen with that. Also want to announce that our indoor early on programming at the City of Hamilton, delivered by partner organizations, but certainly coordinated through the City of Hamilton, all of those indoor programs have been closed until at least January. There are some outdoor activities that early on centers for parents with young children or caregivers with young children. There are some outdoor activities. They will continue with restrictions on numbers, and there's lots of virtual pieces happening through our early on centers. So critically important to keep up that great interaction and that great child development, but it will look different and not the access to the indoor facilities for early on centers. Things like our greenhouses at Gage Park are going to be limited to no more than 10 people. Our museums, which continue, if they were open previously to this week, they continue to be open, but a maximum of 10 people. So there are things that you can get out and do. There are places that you can go, including to restaurants and other amenities within the city, but recognize that there will be some significant restrictions on how you are seated indoors for now for restaurants. It's no more than 10 people and no more than 4 at a table. And there will also be all of the other restrictions and other precautions that are put in place when we've gone to these facilities. So significantly today, I'd end by saying that, we talked about earlier in this week that we're that one step closer to that lockdown. We're nowhere near there in terms of the numbers. So don't want to panic Hamiltonians in that way. But if we get there, if you look at what's happening today in Peel Region and Toronto, you can understand why we're asking Hamiltonians to do their part. Let's get into those less restrictive areas so we can continue to do the things we want, because lockdown is, as its name suggests, a lot of services and things we'd like to do no longer accessible to us. So we'll try our best not to be there. Dr. Richardson.
Thanks very much, Paul. And I'm going to give you an update on cases and then just talk a little bit more about the control measures. So as of today, we are sitting at 2,589 cases in total. So that's 36 new cases that have been added to the count since yesterday. We have 73 deaths to date, and unfortunately, again, reporting one new death today, a woman in her 90s from Chartwell Willowgrove who passed on November 19th. There continue to be a high number of outbreaks. We're at 16 local outbreaks today with 2 new outbreaks added, one at First Place Hamilton and a second one at Advanced Motor Solutions, which is a workplace here in Hamilton. As always, you can find more details about COVID-19 activity on our website. I do want to say I definitely understand the toll that this pandemic has taken on everyone. It's impacted virtually every aspect of our lives and is likely to continue to do so for some time. And there's no doubt that at times you may be feeling like there's no end in sight. We know this week has been a bit of a confusing week as we clarified with the province exactly what their documents meant, and we clarified for the community. And as you've heard, a lot of that coming from Paul just now. The holidays are, of course, just around the corner, and we do start to hear questions about those. We are in this red control category of the provincial framework for at least 4 weeks from when it began, so 3 more weeks. And it's no doubt with these COVID restrictions that the holiday celebrations are going to look and feel different this year. And advice on the celebrations may change as the pandemic changes within our community. I have emphasized the concern about the growing number of cases here locally and the number of outbreaks that we continue to see. The number of cases that we see in our community and the number of outbreaks that we experience go hand in hand. As the daily numbers continue to be at that higher level, there will continue to be outbreaks in congregate settings and will inevitably lead to more hospitalizations and unfortunately to further deaths. I do want to make it clear that in addition to the framework's guidance and the regulatory requirements for workplaces, businesses, and other organizations, everybody needs to be very diligent about the measures that the mayor addressed in his opening. So restricting your close contacts to your household members only and your essential supports. Anybody that lives alone can join with another household for support. All in-person activities should be limited outside of the home to essential activities only, including work, school, fitness and exercise, access to health care, and the purchase of food, drink, automobile maintenance, gasoline, and the like. All social gatherings should be restricted only to your household members that you live with. You should be wearing a mask or face covering when you're around others from another household, when you're out in public places or outdoors and unable to stay physically distant. So that does include that if you're having a support come into the home, like a tutor or a healthcare worker, that you would both be masking while they are there. You should be washing your hands often. And if you have any symptoms whatsoever or are not feeling well, if any of those are consistent with COVID-19, to go and get a test. We do unfortunately continue to hear about people who do go to work when they are having symptoms consistent with COVID-19 or they're out and seeing friends socially. So we continue to be at a critical phase in this wave of the pandemic, and our collective response is ultimately going to determine where we go from here. In order to contain better control, we all have to remain diligent, take the appropriate steps to keep the risk of exposure and transmission of COVID-19 low as possible. It's up to everybody to take responsibility for their actions to protect themselves, to protect their families, to protect the most vulnerable in our community, and ultimately to allow our children to go to school, to allow our healthcare system to service all of us, and for our economy to continue to support our well-being. Rob, I'm going to turn it over to you.
Thanks very much, Elizabeth. Well, I have to say, our health system is in a very high stakes situation at the moment. Hospital occupancy rates have been increasing for several weeks. At the same time, hospital admissions for COVID patients are beginning to rise across the GTHA. Further, ALC rates are very high, sitting at levels that look like we're in the peak of flu season. In fact, it's not flu that is driving these numbers. I think the bottom line is there is no slack left in the system. Yesterday, Hamilton Health Sciences hospitals were sitting at over 100% occupancy, meaning we were operating more hospital beds than we're funded to operate. This rising demand for care is compounded by the fact that we're still catching up from the impact of the first wave of COVID. We've performed 4,000 fewer surgeries so far this year than last, meaning more patients are waiting longer for their procedures. Children in particular are facing longer than average wait lists, over 130% longer than in 2019. We've performed 5,000 fewer diagnostic tests. This is largely due to people missing their appointments. I think fewer people are coming to the hospital out of fear of COVID-19. All of this creates delays in diagnosis and treatment, meaning that people are sicker and require more health resources when they eventually have no choice but to come and see us. We don't have the capacity to absorb a significant second wave of COVID-19 without seriously scaling back our other services. That's why Hamilton's recent move to the red zone is worrisome for us. Hospitals are working hard to ensure that we have the capacity to care for people who need us, but we are only part of the equation. We need our community to step up to help control the spread of COVID-19. If we are unsuccessful, our local healthcare system will face this dire reality. We can't continue to address wait lists and backlogs if we don't have the space in our hospitals to provide care. And in fact, the backlogs will get worse, and that represents a lot of human suffering. On behalf of our staff and doctors and patients, I urge everybody to take the necessary precautions to protect one another from the spread of COVID-19. We're doing our part, but we need everyone to do theirs. Trust the advice of Dr. Richardson and her colleagues, follow public health guidelines, and encourage your loved ones to do the same. So wear a mask, wash your hands, and watch your distance from others. We all have an important role to play, and I think now is the time. My personal view is we're coming close to a point where we will be able to see some light at the end of this tunnel. So now is not the time to let up with all that we're doing. I'm going to pass it over to Keanin Loomis.
All right, thanks so much, Rob. And thank you, Mr. Mayor and Dr. Richardson and Paul for having us on today's media availability. And I want to thank all of our public servants and public health professionals and those certainly within the city of Hamilton and those within HHS and St. Joe's. They've worked tirelessly since March to keep our community safe. And we've supported that because the Hamilton Chamber and the business community understand that the best thing to do for the economy in the long term is to keep the virus under control. And the overwhelming majority of businesses have done a great job and worked extremely hard since the onset of this pandemic to rapidly adhere to the public health guidelines to keep their employees and customers safe despite the impacts they've experienced to the bottom line. The federal provincial subsidies and resources made available to businesses have been generous, but they don't entirely make up for the loss of business that has been experienced. And many businesses, as we know, are struggling right now at this time, especially in certain sectors like the hospitality and restaurant industries. There are a lot of grim statistics out there. I won't share those here, but and those businesses will certainly continue to experience challenges as we endure this winter and adapt to whatever the new normal is. That's why I'm pleased to join this call to implore people to follow the protocols recommended by our public health professionals. We've lived with this virus long enough to know exactly how to control it, wearing masks, keeping your distance, and avoiding crowds. And I know that we have virus fatigue. All of us do. I do. And I know all of us on the call do as well. And we had great news this week. 2 vaccines that are showing great progress. And they really have turned the light on at the end of the tunnel. Despite those notes of optimism, however, the reality is that we're probably halfway through this pandemic. And however, you know what's worse than being in the red zone? Well, it's being in lockdown and just before Christmas as well. And you know what's worse than being limited in dining out or visiting our favorite business? It's not having them at all available to us when this is all said and done. And I think the Premier's announcement today about Toronto and Peel going into lockdown is a wake-up call to us here in Hamilton and a reminder that despite us being in the red zone, it could still get worse. And if we start to see those numbers come down, we'll be out of the red zone in a couple of weeks and we'll have even greater freedoms to look forward to. So when you're being asked to follow public health guidelines, it's because they work. They protect you, your family, the hospital system, and your favorite businesses. I just want to end with a message to the business community, to all of our restaurants, retail stores, and entrepreneurs out there. First, you need a safety plan in place because we're in the red zone and there will be proactive enforcement. Every single business needs to have a safety plan in place. And there are templates out there available to you. So you don't have to start from scratch, but have them do that this weekend so that you're ready in case of inspection. The second thing I want our businesses to know is that you are not alone. Throughout this year, we as the Chamber have continued to deliver on our core mandate to facilitate connections and collective action to strengthen the economic engine of our community. And from the beginning of the pandemic, we've been working hard to keep businesses informed. We immediately launched, in conjunction with the City of Hamilton's Economic Development Department, a dedicated resource on our website detailing COVID-19 business continuity and recovery information, which provides guidance to businesses detailing government assistance, subsidies, and other small business supports. The wage subsidies have been crucial for us as an organization. I know the federal government's rent subsidy portal will be up and running on Monday. The provincial government just today announced increased funding for PPE, energy rebates, property assistance. And finally, this week we made great progress with public health in creating a phone number, and that number is 974-9848, and it's extension 4, and that allows you to ask any question that you have with regards to whether you're operating your business following the guidelines that have been laid out by public health. So I know it's hard to keep on top of everything, but that's why we are here as a chamber. And I urge you to visit hamiltonchamber.ca/COVID-19. If you go to our hamiltonchamber.ca website, it's in the upper right-hand corner, all the resources that you need. And you can ask questions on that webpage as well, and a real live person will respond. And we're not the only resource as well. We got City of Hamilton Economic Development Department. We got the Small Business Enterprise Center. Every single BIA is here to answer questions. Federal and provincial agencies as well are all available and eager to help your business continue to adapt and succeed in this challenging time. And they are all, as I said, just a phone call away. It's clear, the businesses that you care about this community, you've been working hard to ensure your employees, customers, clients, and visitors are safe. And the outpouring of generosity from the business community to support each other and the residents of the City of Hamilton has been so encouraging. The Chamber is dedicated to the ongoing prosperity of our business community, albeit in as safe a manner as possible. Our advocacy to all levels of government is ongoing, and we will continue to engage with our members and all of the business community on how best we can serve their interests locally and beyond. So please reach out for any assistance with accessing these resources that are available. That is it for me, and I'm going to turn it back over to Mayor Eisenberger.
Thank you, Keanin, and thank you, Rob, for your input. Certainly a sobering message that we need to continue to keep up the measures that help stop the spread of this virus as much as humanly possible if we want to have our healthcare system robust and able to provide the kind of care that we all want and anticipate and expect. Then we need to flatten this curve. And of course, we all want our businesses to thrive in our community and survive. And we're kind of in the survival mode now, where we're trying to do everything possible to ensure that if eliminating this virus, or at this point, reducing the spread, is critical to all of those things happening into the future. So the vaccine isn't here. We'd all like to think that we could get vaccinated tomorrow, but that is going to take some time. And while that's happening, there are still going to be measures in place for us to be cautious and careful to ensure that we eliminate the spread. I don't want to announce any more deaths. I think Dr. Elizabeth is probably, and our hearts and minds go out to the 73 community members that have lost their lives, and the many others that have been infected that have had health issues as a result of that. So it just doesn't end at death, but it also can affect long-term health issues for people if they contract the virus. And of course, we know that many people survive, but the spread is where the problem lies, and we need to do everything possible to eliminate that. It can affect everyone, so no one's immune from this, whether it's children or teenagers or middle-aged or older. Obviously, the older population can be more susceptible as a result of underlying health issues, but that applies to anyone that has any underlying health issue. It could put you at risk of some serious health issues that would require hospitalization, and we've certainly seen that on many occasions. So let's continue the hard work that we've done over the past 8 months, getting us to this point. And this is an anticipated second wave that is certainly possibly going a little further than we might have expected, but certainly we anticipated a second wave to occur. And what we do now collectively as a community, individually, is going to make all the difference in the world as to whether or not we stay where we are and go back to hopefully the green zone sooner rather than later, where we can just control measures and not have to lock anything down. Or if it doesn't go the right way, we end up in lockdown like Peel in York. And I do want to Peel in Toronto. And I do want to make the correction. I said earlier on, it was Peel, Toronto, and York. York is not going into the lockdown zone, but Peel and Toronto are, and that starts as of Monday. But as always, I do want, and I do know, and, we keep preaching on this issue that more people need to do a better job of listening to the recommendations and adhering to them. We do know that the vast majority of you out there are doing exactly what you're needing to do. You're being cautious and you're staying physically separated and you're staying home as much as possible. And we thank you for all of that effort. That this is not a lack of appreciation here, that so many people are doing the right thing. We just want to encourage everyone to do the right thing going forward here, now more than ever, since we want to prevent the ongoing spread as much as humanly possible to avoid any further impacts on our healthcare system and certainly on the businesses in our community that we want them all to survive and thrive. And so let's do our best to keep that spread from continuing to occur. And we thank Rob and Keanin for their input on that very, very important perspective. And the small to medium-sized businesses are the mainstay of employment and opportunity in our community, and we need them to flourish. And right now, they're in jeopardy. And what we do today and going forward is going to make a huge difference as to whether we see more business losses and potentially more loss of life as a result. Let me turn it over to Jasmine now for questions from the media before we wrap up. And I think we do have a timeline that we're working towards. Jasmine, go ahead.
Great, thank you, Mr. Mayor. Actually, today, before we go to the media, I'm just going to go back to Paul. Paul has a few additional comments he's just going to make.
Yeah, I just want to address that the Minister of Health today did indicate that there's going to be some changes to the level of gathering size. And this is not, as we have talked about off the top, or I talked about off the top, in terms of recreational facilities, restaurants, those types of things. But in terms of some of those organized events and social gatherings that's moving, the indication was that's moving to a level of 5 indoors only instead of 10. And so again, why it's really important to look at the provincial information and ensure that that's clear. And there will also be some strengthening of the need for businesses, if there are lineups for businesses, to make sure that they are responsible for keeping a 2-meter distance between individuals. And you see a lot of that happening naturally in terms of the ways businesses are operating today. So again, those tweaks are not across the board. Those are to certain elements of our activities, and it again follows Dr. Richardson's comments from day one, that we really, in an indoor capacity, have to severely limit those who are with. So apologies that those are late breaking things because of our timing, but I just wanted to share that, Jazz, before we get to some of the questions. Thank you.
Great, thanks so much, Paul. So we'll move on to media now. We have 8 reporters on the line today. We'll start with 1 question and 1 follow-up for everyone. Dale, first question goes to you, so you can go ahead.
Hi guys, thanks for taking my questions. For Rob, can you just give me your reaction to the province hitting 150 patients in ICU yesterday?
Yeah, so the significance of the 150 in ICU was that it's previously been deemed to be a kind of threshold that would push the province into more severe limitations. So, it's no coincidence that we are seeing the province react strongly today because of the ICU bed situation across the province. It is a precious resource, those ICU beds, and we have to do all that we can to make sure that, for the sickest of the sick people, those are the people that end up in ICU, that we continue to have some capacity to receive those people. Life goes on in terms of people getting sick, people getting into accidents and so on. So it's not just about COVID, it's about preserving capacity in our system for the wide array of people who rely on it for a lot of different reasons.
Thanks, Rob. And my follow-up will stay with you. You mentioned that the hospitals have little to no slack left in the system. What is the staffing like currently for Hamilton Health Sciences? Is there enough? Can you just touch on that?
Yeah, good question. We are holding our own, and I can't say enough how proud and grateful I am to our staff for all the work that they've done over the past 9 months or so. There's no doubt, though, that Health Human Resources, broadly speaking, are at a premium. it is the rate limiting factor for so many things that we're trying to do under our healthcare system. And the pandemic, in many respects, has shone a bright light on some of the pre-existing conditions that the health system had. So things like shortages of OR nurses, which is a national issue, have become more pronounced during the pandemic. Of course, everybody's familiar with the issues around personal support workers and shortages of those. So I guess the short answer to your question is we are holding our own for the moment, but again, it's an area of great concern for us, the shortage of health human resource across the whole system.
Great, thanks, Rob. Next question will be to Lisa Pileski from CHML. Lisa, you can go ahead.
Hi, thanks very much for taking my questions. First question is for Dr. Richardson. You say that if people are not feeling well, they should definitely go and get tested. What is the current situation like in terms of testing? I know there were some issues in terms of delays and things like that a couple months ago. Have those been worked out, and what's the situation like?
Hi, Lisa. Thanks for the question. Yeah, the group that are doing the assessment centers and testing have done yeoman's work. That combined with the clear guidance around who needs to be tested has really helped a lot. So we actually have same-day test capability almost every single day, and certainly next-day capability for many appointments. So people should have no problem whatsoever getting in to get an appointment. We do have some delays, some very small delay in terms of getting results, but we're talking in the range of maybe adding 1 day in terms of getting your results, unfortunately due to some of the equipment at one of the labs, but still results are coming in pretty quickly.
Okay, thanks very much. And I guess my second question would be for Keanin Loomis. In terms of when people are being told that they need to shop locally instead of going to Amazon for their urgent needs, can you just speak a little bit about the importance here in Hamilton on that and how businesses are doing?
Yeah, thanks for that. I think businesses have done an incredible job of adapting to going digital, and we all have our favorites in terms of restaurants and small businesses, and make sure that you're continuing to spend what you were beforehand, and especially when it comes to Christmas, and be a little bit more mindful of where you are spending. I think Amazon does allow you to to focus on more local, but I would also say that there are other platforms out there to be shopping on as well that allow you to shop local as well. So, but we've been working really hard supporting the businesses and going digital. If there are any businesses out there that are still trying to figure this out, we've received a lot of funding through the Digital Main Street project as well. So it's still not too late. Obviously, as I said, we're probably halfway through this in terms of the pandemic, and so there are still a lot of opportunities out there, and other funding opportunities and dedicated supports for businesses to go digital.
Great, thank you, Keanin. Next question will be to Fallon Hewitt from the Hamilton Spectator. Fallon, you can go ahead. Oh, it looks like Fallon's not here anymore. We'll go next to Dan Takema from CBC Hamilton. So Dan, you can go ahead.
Hey there. This will be for Dr. Richardson. Paul had mentioned during the GIC earlier this week that there was you were absent because you had been pulled away to a sort of a gathering or a meeting to discuss steps to take on these kind of large-scale outbreaks that continue in these long-term care homes. We've seen the Willow Grove. There's a new death today, and it's grown to be quite a large outbreak. And there are others that I think 3 others that are over 30. So I wanted to check in and see what's being done when it comes to long-term care homes, and kind of what came out of that meeting as these big outbreaks continue.
Thanks very much. Absolutely, these long-term care home outbreaks are one of the areas where we're most concerned, and we have been watching each day with these folks. We've done initial inspections with them. We have gone in. We've had daily meetings with their leadership and really emphasizing ensuring there's education done around IPAC measures, that's PPE use, all of those sorts of things. And unfortunately, in some of those settings, those outbreaks have continued to grow. And so we've been meeting with the Ministry of Long-Term Care, with Ontario Health West, involved now in those meetings. One of the things we've learned with COVID-19 is we have to have our control measures implemented absolutely to a T. So if there's just a break on a day, if there's, a break occasionally that might happen, people that we know, these institutions are trying very hard to get everybody consistently following them. But if there's these minor breaks, unfortunately, we do continue to see transmission. And so, that we had stepped forward with an order yesterday in relation to one of these, and we're continuing to work very closely and determine each day what the next steps are that might be required.
Okay, sorry, you mentioned an order there, and I don't know if I'm aware of that, if others are. Can you speak to that, please?
So we did, in the case of Chartwell, just to re-emphasize the importance of all of those measures and to make sure they're very clearly done across the board, issue a Section 22 order. We have been working with them all along. Their leadership has done a lot of education. St. Joe's Hospital, who's paired with this facility, has also been doing a lot of work there. But unfortunately, we're just not getting the absolute full compliance that we absolutely need. And so, in those situations, we do go ahead and issue that order just to remind them of all of the steps that need to be taken. And so we know they're working very hard on it, but it's just with COVID-19, you need that absolutely T's crossed, I's dotted to get transmission stopped once it's begun.
Great. Thank you, Dr. Richardson. Next question is to Sebastian Braun from Hamilton Spectator. Sebastian, you can go ahead.
Hello, I have two questions for Dr. Richardson. You mentioned that the case counts in Hamilton have and continue to increase at alarming rates, and that's largely why we've been thrust into the red zone. From a local public health perspective, what do you think of the decision to keep Hamilton out of lockdown? Are you relieved, a little bit surprised?
Thanks very much, Sebastian. So just to clarify, we aren't in lockdown. Lockdown is that gray zone or the measures that Toronto and Peel have been asked to take. We sit in the red zone. And so that's very much where we belong. Our numbers do indicate that we need to be there. The transmission that we've been seeing indicates that we need to be there. And once we're in that zone, we do watch for a full 4 weeks, which is 2 incubation periods for COVID-19, to see that things have changed before control measures are reduced.
Okay. The messaging from the city and public health officials has been pretty clear. Stay home, wash your hands, limit gatherings. What is the city planning to do, if anything, to keep Hamilton out of lockdown? A worst case scenario, right? Will we see more enforcement on gatherings?
So perhaps I'll turn that over to Paul.
Sure.
So we have, from an enforcement perspective, actually dedicated part of our municipal law enforcement staff to be a COVID response team. They do both proactive inspections and visits to establishments, particularly those that would be what we could consider those at higher risk. So we are concentrating a bit on things like restaurants and bars in particular, because there are those restrictions on when you have to stop serving alcohol. And we just know that those social environments are areas where sometimes that guard can be let down. And so we want to make sure the rules are enforced. But we also respond reactively to complaints that come in from the community. And this is enforced 7 days a week. They work both in the day or the evening. So if folks are concerned that we're not out there in the evenings or on weekends, not the case. Our priority right now is to ensure that we follow up in an enforcement way. The good news is that many, the vast majority of our businesses and people, for that matter, individuals, are complying. But we are there, and the days of, as I've been often quoted in the last week or so, the days of education are over. We are clearly into an enforcement mode now. We expect people to understand what the restrictions and the rules are, and we expect them to be following them. And if they choose not to, then they can expect, if they're visited by our bylaw folks, that there will be enforcement.
Great. Thank you, Paul. Next question will be to Joanna from the Hamilton Spectator. Joanna, you can go ahead.
Hi, thanks so much for taking my questions today. My first question is for Rob MacIsaac. Can you talk a bit about what is the state of our ICUs, and have you started to have to cancel elective and non-urgent services and surgeries? And if not, how far away are we from that?
Well, how far we are away is really a function of the response of our community to these public health measures. As of today, we have 11 patients, COVID patients admitted into our hospital. So we are well within our abilities to manage that. We are not at the moment contemplating ramping down procedures or surgeries, although we are certainly mindful of the potential need for it and making sure that we have a thoughtful plan in place if we do need to move in that direction. So short answer, Joanna, we are not ramping down at the moment. I think what happens in the community over the coming days and weeks will really be determinative of the answer to your question.
Thank you so much. And my next question is for Dr. Richardson. Dr. Richardson, the province re-emphasized today that medical officers of health have the option to add restrictions on top of what is already in the red zone. Are you considering doing that at all?
Thanks, Joanna. As we've talked about over the course of the pandemic, where we see situations that are leading to unique concerns here in Hamilton, like we did around fitness centers, then we do bring in further measures. And so we're continually monitoring, looking at that. At this point, there's none that we're seeing from a general perspective. We do, on a facility perspective, if there are issues, as we talked about with long-term care, we do act on a facility by facility basis as well.
Great. Thank you, Dr. Richardson. Next question to Katrina from the Hamilton Spectator. Katrina, you can go ahead.
Hi, thanks for taking my questions. My first question is for Dr. Richardson. I'm hoping you can elaborate a bit more about how Chartwell wasn't complying and when the Section 22 was issued, because this is news to us.
Hi, Katrina. So yes, we've been monitoring with them every day since the outbreak began, and I can tell you they're just small things that may have happened for a day or two when our meetings were going on and when we were reviewing. So they may have been a small break in terms of PPE and donning and doffing, or a small break in terms of screening, and in one instance. And so that I want to emphasize these were not major concerns that were observed, but they were happening from time to time, and unfortunately we continued to see transmission within Chartwell, and so that order was issued on I'm going to make sure I've got the date right. I believe it was Tuesday evening.
Okay, thanks so much. And this question is likely for Paul, I would imagine, but with the province announcing extra restrictions, I suppose, for the red zone, and I know you touched on it with the 5 people and whatnot, but can you speak more to what this means for Hamiltonians or businesses, anything to sort of put it in context locally?
So looking at the updated a presentation package that has now, of course, the gray zone restrictions and these 2 updated pieces in red. I can surmise that the point of this is what we've been talking about for a long time. When it comes to social interactions and gatherings or organizing of some kind of an indoor event, the real point is we shouldn't be doing this. And so I would read into it that the drop from 10 to 5 in terms of those social gatherings, this is not sure too many people are having, well, maybe today, a barbecue in the backyard, but you're getting some people over to have a dinner or whatever else. The answer is it's 5 people. And that also goes for, a small organized event. This isn't impacting, based on the information that's been released today and updated today, it's not impacting the number of people that can dine indoors in the red category. It's still 10. does not impact the recreational pieces, which are really low at 10 anyways. It doesn't go below that. So important to keep that in context. And I think the other piece they're saying for retail is, as we get into these areas where we're restricting numbers of people in buildings, but also coming upon the shopping season, it's really important that business owners and in the retail sector take ownership for what's happening as people want to enter into their business as much as they are taking care of what's happening within their business. And that's that piece about ensuring that that there is a separation of folks. And again, we've seen this from the very beginning. Anyone who went to grocery stores or continues to go to grocery stores, if there is a lineup, if you're in a mall and there are lineups or you've reached the capacity in retail establishments, you often see either decals on the floor or markings on the floor, or security or other staff people outside making sure that there is a separation. And I think that's just a reinforcement that it is not we hope you do it when we're in this type of controlled area. If you are going out to a retail setting, that we expect that both the business owners and the people attending there are doing the right thing in terms of keeping that physical distancing. So those are the two updates that were injected in today. I think that it's more about the personal behavior. What I'm reading into today is channeling the thoughts that Dr. Richardson has shared with us many, many times, which is we are at a stage now where it is not about having people over and having a social gathering. And I think that the province is saying when you're in that red category, it's 5 indoors because it's so important we keep that number low. And as you see from Toronto and Peel, when you get to that level, it is outside of your household, no one. So I think that's the message that's coming across is keep this to a bare minimum. The advice, of course, from our medical officer of health is keep it to those within your household except for essential support people.
Great, thank you, Paul. Next question will be to Maria from the Hamilton Spectator. So Maria, you may go ahead.
Hi. So my question is, Mr. Johnson mentioned earlier that Hamilton is nowhere near the numbers to be put into lockdown. So I wanted to ask, what is the threshold for lockdown? What does it take to get us there?
I'm going to have Dr. Richardson answer that question for us.
I'm sorry, Maria, I didn't fully hear you.
Sorry. So I was just asking after Mr. Johnson said that Hamilton is nowhere near the numbers to be put into lockdown. So I was asking, what is the threshold for lockdown and what will it take to get us there?
Thank you. I think defining those thresholds has been something that the province has been working on this past week, and I need to go and take a look at them and make sure I understand them well before I answer this fully. But in terms of us in particular, our numbers are just hovering around the threshold for red. So that's the good news, and that's where Paul's coming from, I think, in terms of what he's saying is we're sitting in that zone. So we do have some ways to go because we're just sitting at those thresholds. That said, we're going to stay in that in the red zone for the next 3 weeks, regardless of what happens to our numbers in terms of going down. But if they do inch up to whatever the new thresholds are that have been set for lockdown, then of course that would be where we go. So, stay tuned as we digest what's come in. Just as we began this news conference, we'll have more information for you next week.
Okay, thank you. And my next question is for Mr. Loomis. I just wanted to know that if Hamilton does go into another lockdown, what would be the impact on local businesses?
Well, that's why we're imploring everybody to follow the guidelines right now so we don't have to do that because we can't afford it and the businesses can't afford it either. But as I said in my previous response, so many businesses have had a good enough time to go digital, and so I'm hopeful that it's different than the first lockdown where everybody was scrambling to play catch up. And I think that a lot of our businesses, retailers, you see a lot of restaurateurs as well now. There's a way to be able to access them some way. So hopefully not as bad as the first go around, but like I said, we now know what we need to do to avoid that. And so that's why we're here on this call to implore people to do that.
Great. Thank you so much, Keanin. Thanks everybody for your questions today. Mr. Mayor, I will pass things back to you for some quick wrap up.
Thank you. Thank you, Jasmine. And thank you to Rob MacIsaac, that CEO of Hamilton Health Sciences, and Keanin Loomis for your perspective. It's pretty clear that we're united in terms of leadership in our community as to what we're asking people to do for all the right reasons. So we appreciate your joining us, and your message certainly, I think, resonates with the people in our community. Bill Custers and the entire team at Cable 14 and Clear Cable, thank you so much for your help and assistance in putting these media advisories together. And of course, the public health measures that we've talked about, I'll just repeat them quickly. Stay home as much as you can. Keep your distance from people you don't live with. Wear a mask. It is the key, biggest issue you can do to protect yourself and others, and keep washing your hands as much as possible. And if you need additional information, you can go to the Chamber website in terms of business, in terms of the response to the red zone, hamilton.ca/coronavirus. All the updated information is going to continue to be loaded up there as we get it. And I do apologize for the ongoing changes in the information and regulations and requirements, but we're all trying to manage a very dynamic situation the best way possible, and that means we have to adapt as we go. And that's certainly what the province has been doing, and that's what causes us to continue to have to update new information based on where the cases are going. And lastly, a reminder that our next update, it will be next Thursday at 11:30, as opposed to on Monday, which is our usual time slot. So next Thursday, 11:30, November 26th, we'll be back here to give you a media update and community update as to where we're at and how we're doing. And hopefully we will have improved. And if you take all of those appropriate measures, we'll see that in the numbers that we get next week sometime. Take care of yourselves, be safe, look after your friends and neighbors, and try and have a good weekend.
Are you free on Monday nights and looking for the hottest game in town? It's right here on Cable 14, Kiwanis TV Bingo, giving away a $5,000 prize board each and every week, all while supporting children and youth in Hamilton. See you Mondays at 7.